Wound management in tropical climates presents a unique and formidable challenge. The combination of high heat, pervasive humidity, a distinct microbiological landscape creates an environment where even minor wounds can rapidly become complex and infected. This setting accelerates bacterial proliferation and complicates the healing process. Clinicians must therefore adopt a specialized approach, moving beyond standard temperate climate protocols. The persistent moisture in the air can compromise dressing integrity, create an ideal breeding ground for pathogens, making diligent infection control an absolute necessity for positive patient outcomes. Understanding these environmental pressures is the first step toward effective tropical wound care. The fundamental principles of wound healing remain universal. However, their application requires significant adaptation in tropical regions. High ambient temperatures increase metabolic rates and can lead to greater wound exudate, which requires more frequent dressing changes and careful moisture management. Furthermore, socioeconomic factors often play a role: limited access to clean water, advanced medical supplies, and healthcare facilities in many tropical areas. These resource constraints demand innovative and practical solutions from clinicians. The goal is to create a clean, protected, and a balanced wound environment, despite the external conditions working against it. This requires a heightened sense of clinical awareness and resourcefulness. A thorough and systematic wound assessment is the cornerstone of effective treatment. In tropical climates, this initial evaluation must be particularly detailed. Begin by documenting the wound's etiology, document the wound's location, document the wound's induration, measure the wound dimensions at first consultation, measure length, measure width, measure depth. Observe the wound bed for tissue type and amount, note granulation tissue, note slough, note eschar, assess any exudate for quantity. Assess exudate color, assess exudate consistency, inspect peri-wound skin closely, look for maceration, look for erythema, look for induration. Remember, humid environments worsen these signs and may indicate spreading infection. Understand the local pathogen profile: Staphylococcus aureus, Streptococcus pyogenes, Pseudomonas aeruginosa, Klebsiella pneumoniae, Acinetobacter baumannii. These organisms thrive in warm, moist conditions. Fungal infections, especially Candida species. Be aware of Burkholderia pseudomallei, which causes melioidosis. Consider mycobacterial infections that present as non-healing ulcers. Maintain a high index of suspicion and a low threshold for wound cultures. Assess the patient's overall health and social context. Review nutritional status, screen for diabetes, assess peripheral vascular disease, consider immune function, note prevalence of malnutrition, note prevalence of anemia. Ask about living conditions, ask about access to clean water for hygiene, ask about the patient's ability to adhere to treatment. Use this information to create realistic management and include patient education on hygiene, include patient education on nutrition. Documentation is non-negotiable. Use a standardized wound assessment tool for consistency. Take serial photographic documentation to track changes. At each visit, note pain, note odor, note increases in exudate. This meticulous, multifaceted assessment gives the information needed to develop an individualized, environment-appropriate treatment plan and set the stage for successful healing and infection control. Effective wound cleaning is the first line of defense against infection. The primary goal is to remove surface contaminants, loose debris, excess exudate without damaging healthy tissue. Use a sterile isotonic solution, for example, 0.9% normal saline, for routine cleansing. Where sterile saline is scarce, boiled and cooled potable tap water can be a safe alternative. Apply the solution with gentle pressure by pouring it over the wound or by using a syringe without a needle to create a gentle stream. Avoid harsh antiseptics. Hydrogen peroxide, povidone, iodine, they can be cytotoxic to healing tissue. Debridement removes non-viable tissue. Slough eschar to reduce bacterial load and promote healing. Early recognition of wound infection is critical to prevent systemic complications. Clinicians must be vigilant for both classic and subtle signs. Increasing pain, erythema, redness that extends from the wound margin, localized warmth, purulent discharge or pus. By understanding and addressing the specific challenges of the tropical environment, we can significantly reduce the risk of infection and improve healing trajectories for our patients, preventing acute injuries from becoming chronic, debilitating conditions. Ultimately, successful wound care in the tropics hinges on a proactive and meticulous approach. It is not enough to simply treat a wound. One must anticipate the environmental challenges and actively work to counteract them. This involves a deep understanding of local epidemiology, careful patient education, and a commitment to rigorous infection control measures at every stage of the healing process.